So hello everyone, and today we'll be discussing the case 14 of the case discussion series, and it's a very interesting case. So we have a 13-year-old girl who presented with recurrent pain in the lower abdomen along with distension since the past 3 months, and the pain increases every month. The girl had not attained menarche, and this was the ultrasound picture which I did, and here we can see that there is a collection with internal echoes which is seen in the cervix and the endometrial cavity. This is the urinary bladder, and this is the uterus, and this is the endometrial cavity, and this is the collection which is seen in the cervical canal as well as the endometrial cavity, and it was also seen in the vagina. This is the report that I had given, that there was gross distension of the uterine cavity, the cervix, and the vagina, with collection showing internal echoes within it, suggestive of hematometrocolpos, likely due to imperforate hymen. The bilateral ovaries were appearing normal in size and echogenicity. What exactly is hematometrocolpos? It's actually blood-filled distended uterus in the vagina, usually due to anatomical mechanical obstruction, which obstructs the menstrual blood. And it is commonly associated with Mullerian duct anomalies, like uterine diadelphys, and along with anal, cardiac, and renal and vertebral anomalies. Etiology in most of the cases is imperforate hymen. Other etiologies include transverse vaginal septum, vaginal atresia. So the clinician had advised an MRI pelvis for the girl to rule out other anomalies which were not seen on ultrasound. So this is the picture of MRI pelvis of the girl. This is the T1 weighted images coronal section, where we can see there are two horns and there is content within the cavity which is T1 hyper intense, and there is one internal septation which is not reaching up to the cervical canal. It is within the uterine cavity only. There is no internal septation within the vagina and the cervix, and the ovaries are appearing normal bilaterally. These are the T2 weighted images, where again there is some hyperintensity. T2 shading is seen. These are again the T2 weighted axial images, where we can see the hyperintense content within the uterine cavity and the cervix and the internal septation. So this is a report that I had given, that the uterus has two horns with an internal septation not reaching up to the cervix, which was suggestive of bicorporeal septate uterus belonging to class U3C of Escherichia classification. The older classification, that is the Mullerian anomaly classification, it belonged to a bicornuate unicollis uterus class 4. The uterine cavity, the cervical canal, and the vagina were grossly distended with T1 and T2 hyperintense contents suggestive of hematometrocolpos, likely due to imperforate hymen. That is why I had given V3 in the Escherichia classification, which is imperforate hymen or transverse vaginal septum. The ovaries were appearing normal bilaterally in signal intensity as well as morphology. So what exactly is Escherichia classification? To understand that, we first need to understand the embryology of the uterus and the vagina. So the female reproductive tract develops from a pair of Mullerian ducts. These are the Mullerian ducts that form the fallopian tubes, the uterus, the cervix, and the upper two-thirds of the vagina. The ovaries and the lower one-third of the vagina have different embryological origin. So the important steps in the formation of the uterus and the upper vagina is that there is formation of paired Mullerian ducts followed by its fusion. These Mullerian ducts fuse into a single uterus, cervix, and upper vagina, and finally there is a resorption of that septum, which leads to normal cavity formation. So failure of formation of the Mullerian ducts can result in aplastic or hemiuterus. Failure or incomplete fusion of the ducts results in bicorporeal uterus, as is there in this case, and incomplete septal resorption leads to septate uterus. So this is the Escherichia classification, where there is U0 to U6. U0 is normal uterus, U1 is dysmorphic uterus, it can be T-shaped uterus or infantilis. U2 is a result of failure of resorption of the septum. So it is a septate uterus. It can be partial or it can be complete. But the important thing that has to be remembered in septate uterus, that the outer contour of the uterus is actually normal, and this differentiates septate uterus from bicorporeal uterus. U3 is bicorporeal uterus with right and the left corpus because of the failure of the fusion of the Mullerian ducts. The outer contour is actually abnormal here with an external cleft of the fundus, which is there in our case. U4 is hemiuterus, which is a result of unilateral failure of formation of Mullerian duct, and U5 is aplastic uterus, which results in bilateral failure of formation of Mullerian ducts, and U6 is actually unclassified. And this is the complete Escherichia classification, which includes uterine anomaly, cervical and vaginal anomaly. Uterine anomaly is classified from U0 to U6, cervical from C0 to C4, and vaginal from V0 to V4. We have already discussed about the uterine anomaly. Cervical anomaly, C0 is normal cervix, which was there in our case. It can have septate cervix, which is C1, double normal cervix, C2, unilateral cervical aplasia is C3, and complete cervical aplasia is C4. Normal vagina is V0, longitudinal non-obstructive vaginal septum is V1, longitudinal obstructive vaginal septum is V2, transverse vaginal septum or imperforate hymen is V3, and V4 is vaginal aplasia. So this is the older classification of the Mullerian duct anomaly. It is still preferred by some clinicians. That is why I had given this classification as well. Class 1 is uterine agenesis or uterine hypoplasia. Class 2 is unicornuate uterus. Class 3 is uterine didelphys. Class 4 is bicornuate uterus. Class 5 is septate uterus. Class 6 is arcuate uterus. And class 7 is actually the T-shaped uterus or diethyl steriferous exposure in utero. That is dysmorphic uterus, which is U1 of Escherichia. So this is actually another case that I had got on ultrasound, where again we can see that there are two uterine cavities, and these are the ovaries. Those again a bicorporeal uterus without any internal septation. It's a complete bicorporeal uterus.